Hello, everyone, and welcome back. If you're in the final weeks of pregnancy, you're probably wondering, is labor starting? Are these cramps normal? Did I just lose my mucus plug? Should I go to the hospital? Today, we're talking about the 8 early signs that labor may be approaching. Some of these signs can happen hours before labor begins, while others may happen days or even weeks beforehand. By the end of this video, you'll know which signs are normal, which signs require a call to your healthcare provider, and how to recognize when labor is truly beginning. Let's get started. Sign number 1, losing the mucus plug. One of the most talked about labor signs is losing the mucus plug. The mucus plug is a thick collection of mucus that sits inside the cervix during pregnancy. Its job is simple: to help protect your baby from bacteria entering the uterus. As your cervix begins softening and opening, the mucus plug may come out. Some women notice one large glob of mucus. Others notice smaller pieces over several days. The mucus may be clear white, yellowish, pink tinged. Important: losing your mucus plug does not necessarily mean labor will start immediately. Some women go into labor within hours. Others may still be pregnant for another week or more. So think of it as a sign that your body is preparing for labor, not proof that labor has started. Sign number 2, the bloody show. The bloody show is another common sign. This occurs when small blood vessels in the cervix break as the cervix begins changing. You may notice pink mucus brown discharge light red streaks. This is usually normal. However, heavy bright red bleeding is not considered a normal labor sign. If you experience bleeding similar to a menstrual period or heavier, contact your healthcare provider immediately. The bloody show often means labor is getting closer. For some women, labor starts within hours. For others, it may still take several days. Sign number 3, lightning crotch. Many moms describe this as a sudden electric shock or stabbing pain in the vagina or pelvic area. It can stop you in your tracks. The good news? It's usually normal. Lightning crotch happens because your baby is moving lower into the pelvis and pressing on nerves. This can create sudden shooting pains. Although uncomfortable, it generally means baby is getting into position, baby is descending, your body is preparing for birth. Gentle stretching, walking, and prenatal exercises may help reduce discomfort. Sign number 4, increased pelvic pressure. As labor approaches, many women feel more pressure in the pelvis. You may notice baby feels lower. Walking becomes more difficult, increased pressure when standing, frequent urges to urinate. This is often called lightening. It means the baby's head is moving deeper into the pelvis. Many women feel relief in their breathing because the baby is no longer pushing as much on the lungs. At the same time, pressure on the bladder increases. This can happen days or weeks before labor. Sign number 5, nesting instinct. Have you suddenly started cleaning everything? Organizing closets? Washing baby clothes at midnight? You may be experiencing nesting. Nesting is a burst of energy that many women feel shortly before labor. Scientists aren't completely sure why it happens, but it appears to be nature's way of preparing mothers for their baby's arrival. Just remember, don't exhaust yourself. Labor requires energy. Get plenty of rest between your cleaning projects. Sign number 6, diarrhea or loose stools. This sign surprises many women. Before labor begins, your body releases hormones called prostaglandins. These hormones help soften and prepare the cervix. They also stimulate the bowels. As a result, many women experience loose stools, frequent bowel movements, mild stomach upset. This can happen hours or even a day before labor begins. Think of it as your body's natural way of preparing for birth. Stay hydrated and continue drinking plenty of fluids. Sign number 7, cramping and lower back pain. Many women experience cramps before labor starts. These cramps often feel like menstrual cramps, aching in the pelvis, tightness in the lower abdomen. You may also feel lower back pain that comes and goes. As labor approaches, these cramps become stronger and more regular. Unlike random pregnancy discomforts, labor cramps typically develop a pattern. If your cramping is increasing in intensity and frequency, labor may be approaching. Sign number 8, real contractions. This is the biggest sign of all. Real labor contractions become stronger over time, become closer together, last longer, do not go away with rest. False labor contractions often disappear when you change position, drink water, rest. Real labor contractions continue regardless. A helpful guideline is the 5-1-1 rule. Contractions are 5 minutes apart, lasting 1 minute each, continuing for 1 hour. Always follow the advice of your healthcare provider regarding when to head to the hospital. Remember, no single sign can guarantee labor is starting. But when several signs appear together, such as losing your mucus plug, bloody show diarrhea cramping, increased pelvic pressure, regular contractions, there is a good chance labor is approaching. Every pregnancy is unique. Trust your body, stay calm, stay informed, and always contact your healthcare provider if you're unsure about any symptoms. If you found this video helpful, don't forget to like, subscribe, and turn on notifications. Thank you for watching, and I wish you a safe, healthy, and empowering birth experience.